This program is presented by the Centers for Disease Control and Prevention.
Almost everyone knows someone who's been affected by cancer. A family member, a friend, your best friend's brother. What you might not know is that the number of new cases can be reduced, and many cancer deaths can be prevented. This podcast will help you learn how to reduce your cancer risk. 1 in 3 cancer deaths can be avoided through prevention, and another third through early detection and treatment. Screening for cervical and colon cancers helps prevent these diseases by finding precancerous lesions so that they can be treated before they become cancer. Screening for cervical, colon, and breast cancers also helps find these diseases at an early, often highly treatable stage. Your cancer risk can be reduced by avoiding tobacco, limiting alcohol use, avoiding excessive exposure to ultraviolet rays from the sun and from tanning beds, eating a diet rich in fruits and vegetables, maintaining a healthy weight, and being physically active. Vaccines can also help reduce cancer risk. The human papillomavirus, or HPV vaccine, helps prevent most cervical cancers and some vaginal and vulvar cancers. And the hepatitis B vaccine can help reduce the risk of liver cancer. CDC is working on a number of initiatives to reduce the burden of cancer around the world. For more information, please visit www.cdc.gov/cancer.
For the most accurate health information, visit www.cdc.gov or call 1-800-CDC-INFO.
Obesity is a leading cancer risk factor. Overweight and obesity are associated with at least 13 types of cancer. Unfortunately, 2 out of 3 adults in the United States weigh more than recommended. More than half of Americans don't know that overweight and obesity can increase their risk for cancer. Some states and communities provide support that can help people get to and keep a healthy weight. Activities include supporting comprehensive cancer control programs that focus on cancer prevention, education, screening, quality of care, and survivorship, making it easier to choose healthy food options where people live, work, learn, and play, building communities that make it safer and easier for people to be physically active, and partnering with business and civic leaders to make community changes that increase healthy eating and active living. To learn more, visit cdc.gov/vital signs.
What to know about cancer. What is cancer? Causes. Treatments. Types. Outlook. Takeaway. Cancer causes cells to divide uncontrollably. This can result in tumors, damage to the immune system, and other impairment that can be fatal. In the United States, an estimated 15.5 million people with a history of cancer were living as of January 1, 2016, according to a 2018 report from the American Cancer Society. In this article, we examine types of cancer, how the disease develops, and the many treatments that help improve the quality of life and survival rates. What is cancer? Cancer cells do not die at the natural point in a cell's life cycle. Cancer is a broad term. It describes the disease that results when cellular changes cause the uncontrolled growth and division of cells. Some types of cancer cause rapid cell growth, while others cause cells to grow and divide at a slower rate. Certain forms of cancer result in visible growths called tumors, while others, such as leukemia, do not. Most of the body's cells have specific functions and fixed lifespans. While it may sound like a bad thing, cell death is part of a natural and beneficial phenomenon called apoptosis. A cell receives instructions to die so that the body can replace it with a newer cell that functions better. Cancerous cells lack the components that instruct them to stop dividing and to die. As a result, they build up in the body, using oxygen and nutrients that would usually nourish other cells. Cancerous cells can form tumors, impair the immune system and cause other changes that prevent the body from functioning regularly. Cancerous cells may appear in one area, then spread via the lymph nodes. These are clusters of immune cells located throughout the body. Causes. There are many causes of cancer, and some are preventable. For example, over 480,000 people die in the U.S. each year from smoking cigarettes, according to data reported in 2014. In addition to smoking, risk factors for cancer include heavy alcohol consumption, excess body weight, physical inactivity, poor nutrition. Other causes of cancer are not preventable. Currently, the most significant unpreventable risk factor is age. According to the American Cancer Society, doctors in the U.S. diagnose 87% of cancer cases in people ages 50 years or older. Is cancer genetic? Genetic factors can contribute to the development of cancer. A person's genetic code tells their cells when to divide and expire. Changes in the genes can lead to faulty instructions, and cancer can result. Genes also influence the cell's production of proteins, and proteins carry many of the instructions for cellular growth and division. Some genes change proteins that would usually repair damaged cells. This can lead to cancer. If a parent has these genes, they may pass on the altered instructions to their offspring. Some genetic changes occur after birth, and factors such as smoking and sun exposure can increase the risk. Other changes that can result in cancer take place in the chemical signals that determine how the body deploys, or expresses specific genes. Finally, a person can inherit a predisposition for a type of cancer. A doctor may refer to this as having a hereditary cancer syndrome. Inherited genetic mutations significantly contribute to the development of 5 to 10% trusted source of cancer cases. There are many treatments are available but not genuine. In modern treatment people are going for chemo and radiation, but as a doctor I have not seen any people are treated and live after chemo. In our clinics many people are coming in last stage after chemo radiation. They were much better before chemo and radiation. They were in first stage but chemo radiation make their life much critical. Now they are all in 4th stage, means last stage. They spend 11 lakh rupees and more. Now they were in last stage near to death. If the educated people commit such mistake, then whom you blame? But there is perfect treatment and herbal homeo treatment. If you use Ayurveda with homeopathy medicine you will not die. 4th stage cancer patient will come to 1st stage cancer. If he or she continue with same medicine then he or she will away from all type of cancer 100%. We treat all type of cancer and all 2000 diseases. It is low cost treatment, safe, no side effects. This video is for awareness, not for financial gain. Choice is your life or death. Call me anytime 0999 390 6875. My website www.freecancerfree.com. DrAjoy1@gmail.com.